Thank you, Mr. President. I want to thank my Vice Chairman of the Indian Affairs Committee and thank the presiding officer who chairs that committee. I'm honored to serve under both of you. And I'm speaking today to discuss the devastating effects that the various Republican health care proposals that have been made would have on Indian country. Republicans are now considering a straight repeal of the Affordable Care Act with no replacement. This policy, like others that have come before it, would have a devastating effect on Native communities. So today I want to describe some of the healthcare challenges that these communities face and how the Affordable Care Act helped address some of those challenges and how repealing the Affordable Care Act would undermine these gains and further jeopardize health care for an already vulnerable population. I've served on the Indian Affairs Committee for the past 8 years, and I am continually shocked by what I hear almost every week from tribal leaders and other witnesses about the challenges facing Native communities. One of the biggest challenges is that the federal government consistently falls short of its responsibilities to Indian communities. There is a lack of attention to the concerns of Native communities. There's a dysfunctional bureaucracy and a Congress that doesn't adequately fund Indian programs, and this can create a vicious cycle. When programs don't have adequate funding, they don't work as they should. And some of my colleagues who have failed to provide Indian country with the funding they need point to the resulting program inefficacies as justification for continuing to cut and underfund critical programs. And that just doesn't make sense to me. Healthcare has fallen prey to this vicious cycle. Even though the federal government has a trust responsibility to provide health care to tribes and to their members. Medicaid and the Indian Health Service are both part of this trust responsibility. Now, over the years, the Indian Health Services has suffered from lack of resources, poor staffing, and other challenges. The Vice Chairman was right. Don't get sick after June is unfortunately something that is you hear over and over again, said with some some irony and but also hurt on Indian country because the funding really runs out then. And these challenges, this means that many in Indian country, particularly those living in remote areas, don't have reliable access to the medical care they need on a timely basis, and this is healthcare that has been promised by treaty and by our Constitution. Prior to the ACA, funding shortages meant that IHS was only able to provide people with the most basic services, and so a lot of the care that people needed was simply not available. For example, prior to the passage of the Affordable Care Act, the Indian Health Service could not afford to provide vital services, including women's health screenings like mammograms or basic diabetes care. If you suffered from diabetes, you often had to wait until dialysis was required or limb amputation was needed before being able to receive care. That is just unconscionable. That's terrible. What's more, American Indians and Alaska Natives were more likely to be uninsured than non-native populations, which meant that many people who needed care that wasn't covered by the IHS simply went without. The ACA helped change all of this for the better. First, the ACA gave states the option to expand their Medicaid programs to include low-income adults without dependent children. Thanks to Medicaid expansion, 11 million Americans, including more than 290,000 American Indians and Alaska Natives, were able to get health insurance. The ACA's Medicaid expansion made it possible for an estimated 60% of uninsured American Indians and Alaska Natives to qualify for health care coverage. This expansion, coupled with other Medicaid policy reforms, such as those that simplify the enrollment process, help increase the total number of people covered under the program. In fact, IHS reported earlier this year that 42% of patients receive services, of those who received the services did so because they had coverage through Medicaid. That's what the Indian Health Services said. 42% of those who received health care services did so because they're covered by Medicaid. In Grand Portage, located is a beautiful spot on the northeastern corner of Minnesota. This meant that well over 20 more band members, many of them children, received coverage. And we know from a recent report out of Georgetown University that nationwide 54% of children in American Indian and Alaska Native families were enrolled in Medicaid in 2015 compared to 39% of all children. This program has been a vital source of coverage, and with health insurance coverage, people have finally been able to access the health care they need. And that's what health care is really about. Healthcare is about having coverage and so that you have the routine visits for primary care. So if you are diabetic, you have routine visits. It's not about the emergency, heroic event. Healthcare is about the constancy of care. That's what improves people's health. That's what improves their lives. Another way the ACA helped improve health care for Native populations was by transitioning the IHS to be the payer of last resort. By establishing that Medicare, Medicaid, and private insurance would be the primary payers, the ACA ensured that there was more money going to provide a wider range of services that people needed while simultaneously reducing the financial burden on the IHS. Yet there's more that we need to do to strengthen the Affordable Care Act and improve rates of coverage and access within Native communities. For example, we need to do more to address workforce shortages and lack of competition in insurance markets in rural areas. The presiding officer knows that. And it's imperative that we tackle the opioid epidemic in Indian country. The recent Republican efforts to repeal the Affordable Care Act would do nothing to address these outstanding needs and would undermine the recent health and coverage gains that tribal communities have been able to achieve. And I know the last bill had money targeted at opioid treatment, but it wasn't anywhere near what would be taken away when the Medicaid expansion and cuts to Medicaid are figured in. The Republicans' proposals would hurt Indian communities in a number of important ways. First, they would cause tens of millions of people, including many American Indians and Alaska Natives, to lose coverage, with between 15 and 18 million Americans losing coverage immediately. For example, Republican plans would end the Medicaid expansion, as I've said, which has been central to providing health coverage to many in Native communities. Second, they would jeopardize the sustainability and stability of the individual market while giving huge tax breaks to powerful corporate interests. And finally, they would increase premiums and reduce subsidies that low-income people received to help pay for health care, which would put private health coverage out of reach for so many. Efforts to repeal the Affordable Care Act are just bad for Native communities and bad for the country as a whole. As many of you know well, American Indians and Alaska Natives are twice as likely as compared to non-Hispanic whites to be overweight, obese, diagnosed with diabetes, and experience hopelessness and depression. In Minnesota, American Indian women are also more likely than whites to be diagnosed with maternal opiate dependency during pregnancy, and more children are born opioid dependent. Reducing coverage and driving up healthcare costs is the last thing these communities need. Indian tribes in Minnesota and in North Dakota and in all of our states are grappling with challenging and complex healthcare needs. They need our help. They don't need legislation that is hastily put together for ideological reasons. They don't need policies that undercut their care and livelihood. I believe that we need to work together across partisan lines. And I really hope that that's what we're going to do. The Republican health care plans that have been put forward so far break the federal government's trust responsibility and undermine the very programs that are helping Indian communities. This is what I sincerely believe. I urge my colleagues to reject Republican efforts to repeal the Affordable Care Act and instead work with us on a bipartisan basis, in regular order, with hearings before our committees, to strengthen care options for our Native communities and for all Americans. I believe we can do that, and I can believe that we can work together. And it's just the right thing to do. Thank you, Mr. President, and I would throw it back to the Senator, the Vice Chairman of the Indian Affairs Committee, and the Senator from New Mexico.